Commissioners work session. A reminder for anybody who might be listening online or who listens to this later, work sessions are for informational purposes only. It's an opportunity to receive information and for commissioners to ask questions and have discussion amongst ourselves and with partners. If anybody wishes to make public comment about anything they hear today, we will reconvene for our business meeting at 5:30 this evening, where we always have a general public comment time, and otherwise you're welcome to reach out to commissioners in writing at any time. And with that, I'm going to turn it over to Jill Jolliker to introduce our guests and kick us off.
Thanks, commissioners. Really excited to do this update for A Place for Everyone for you all. I'm going to try to keep us moving quickly, but before we dive in, I want to make sure we'll start with the table. We'll let our guests introduce themselves, and then I'll make sure I note the folks that are in the audience. Christy, do you want to start?
I'm Christy Shutter. I'm the program administrator for the Homeless Solutions Division and case manager lead for the homeless response team.
I'm sorry, we can't hear that on Zoom.
Can you go a little closer? Say it again. I'm Christy Shutter. I'm the program administrator for the Homeless Solutions Division and case management lead for the homeless response team.
I'm Sarah Kinder. I'm the Douglas County Regional Coordinator with Kansas Statewide Homeless Coalition.
I'm Stacy Schroeder with Lawrence Habitat for Humanity and the co-convener for the Community Engagement Work Group.
Oh, I turned it off. I'm Erica Zimmerman, Executive Director for Lawrence Habitat for Humanity and filling in for the conveners of the Affordable Housing Group.
Hi, everyone. I'm Jonathan Smith, Executive Director at Lawrence Douglas County Public Health.
Bob Tryansky, Director of Behavioral Health Projects for Douglas County.
And I'm just going to shout out our colleagues that are in the audience. Kelby Sanders with Mirror Inc. on the homeless response team. Brandon McGuire, City of Lawrence. Matthew Falk with Burt Nash. Kristen Egan on our county team. And Hannah Bolton with Cardinal Housing Network. And that's a great segue into, well, I'm going to come back to to the slide before this. We have partners in the room, but this is a full list of all the partners that have been a part of developing this plan and are currently a part of operationalizing the plan. So this is truly a collective impact model that we've developed together. And if someone's not on here, I apologize in advance, but we try to keep track of all of our partners, and it's a great representation of our work. So to back up a little bit, background on this process. This is an incomplete timeline, but in our previous presentations that we've provided on A Place for Everyone, this is the best summary of where we started and gives you a glimpse of where we ended. So we started this conversation in April of 2021. And before April of 2021, the conversation in the community was, this is not my job. Well, it's not my job either. And where we are today in terms of the level of collaboration and cooperation, starting with the city and the county, it's night and day from where it was before. And I think we're all in this room really proud of that. And the work that we've been able to accomplish is a reflection of that work. So Sarah Plinsky and Craig Owens said to Brandon and I, get a group together and figure out a plan. And this timeline walks through that. So we did have some help from our partners at the Kansas Department of Aging and Disability Services that brought in subject matter experts like Sam Sembris, who developed the Pathways housing model, and compelled us with our partners to come up with a vision and slowly develop a plan. So we convened a group of stakeholders in May of 2021, and we continued to meet every single month following to develop what would eventually become A Place for Everyone. We knew that in order to develop that strategic plan, we first had to know what are our weaknesses. We had to assess our system. So many of the folks in this room are familiar with the 2 needs assessments that the county and the city had commissioned to inform our plan. One of those was a homeless systems needs assessments performed by the KU Center for Public Partnerships and Research. And then we also had one commissioned by the Corporation for Supportive Housing for a supportive housing needs assessment. Once we had that, we developed a draft plan. We continued to meet as on a monthly basis. The subgroups were also meeting in the focus areas that were identified because of those needs assessments. And then we started a series of community conversations. And I believe we did 4 to 5 community conversations, including focused conversations with our lived experts in the community. And many of the things that you're going to hear about today in terms of the strategies and the progress we've made to date are a reflection of those strategies, or the feedback that we got from the community, and how we tried to create a plan that best reflected what we heard from the community in those sessions. So we had to spend a considerable amount of time making revisions to the plan and making sure that it reflected what we heard from community. And then we presented to the city and the county commission a couple times to get their feedback. We went back and we tinkered some more and ultimately got to the point where in 2024, the plan was adopted by the city and county commission. And we began moving forward to operationalize our plan. We consider this plan very much a living document. I said this in our in the cover memo for this. The direction that we got as a collective group was to develop a plan, develop a strategic vision, be realistic with that. But we were not charged with identifying how it would be paid for. So you'll hear today that sustaining funding for this work continues to be a challenge for us, but we've been pretty creative to date, and we're going to continue to be creative. So I'm not going to read this word for word, but these are our objectives, very much focusing on the policy, systems, and environmental changes that we want to see in this community related to housing. Here are our priority populations for our plan. These are very much a direct reflection of what the data told us in those needs assessments. Who are the individuals that are experiencing homelessness at the highest rates and are most likely to experience homelessness at the highest rates? One of the areas that we continue that was elevated in the needs assessments, and we continue to try to understand the why, is females that experience homelessness in Douglas County. They experience it at a disproportionate rate compared to national and state levels. So we're still trying to understand why is that. What are the conditions that are causing that, and what are the interventions that could solve that? So we're still working on that. I think we have some great progress in terms of partners and projects, but that was one thing that, if you remember, that was the data told us was a disproportionality, but the data also said that these were the priority populations we should focus on. There's some additional ones here that you can see, and we know that there's probably a lot of overlap in these priority populations. Okay, so the lived experience, this is one of the newer parts of the Place for Everyone plan that neither of the commissions have seen. We developed this one as a replacement for what was previously the diversity, equity, and inclusion section of the plan. We made a strategic decision in the steering committee to replace that section of the plan, and we replaced it with the lived experience, just to make sure that we were communicating clearly about how this plan is shared amongst the city and the county and our different partners, and the perceptions, real or perceived interpretations of our federal and state partners. It's just a reality that we had to deal with. But the lived experience part of the plan is directly reflective of the recommendations that were in those 2 needs assessments, that we needed to make sure that we were utilizing lived experience throughout the plan. So we've established an objective here that by 2027, we will have a lived experience advisory board that provides feedback and diverse perspectives of individuals with lived experience of past or present homelessness and housing insecurity on current and proposed initiatives, programs, and policies that support ending chronic homelessness in Douglas County. So the specific strategies speak to just really the logistics of how we will go about designing and developing that lived experience advisory board, and everything from bylaws to onboarding, stipends for community members that are chosen for that board to participate. Yeah, I'm going to leave that at that. The one thing that's a caveat here, we're going to continue to talk about this focus of area of the plan, but one thing that we know is that we already have lived experience embedded throughout the plan. We have it embedded in the teams that are currently working in our community. We have it in agencies, different organizations, and different positions throughout our community. That may not be what they lead with, but we know that we have a lot of lived experience in our work teams. But how can we be more intentional? That's where this part of the plan speaks to. Okay, I'm going to go through some slides and I'm going to let Erica talk through some of these.
Thank you, Jill, and thank you, commissioners, for allowing us to give you this update on the work that we've been doing. This first slide right here is just a call out and recognition of all of the partners who've come together on the affordable housing work group. And we just want to thank them and recognize them for their work in creating the plan and then continuing to carry out the plan. Okay, I'll talk faster. So plan strategy 3, these are the completed strategies that we've completed thus far. Strategy 3 was making recommendations for the land development code that reduced barriers to affordable housing development. While we have completed this, we developed and submitted the recommendations to the Land Development Update Steering Committee. While we completed that, the codes were not adopted, the updates that we provided, therefore limiting the impact on development, flexibility, and cost efficiency. Strategy 5 was enact and enforce source of income non-discrimination. It's been the enforcement mechanisms have been established for sources of income discrimination protections under the City of Lawrence ordinance. This represents a significant policy and equity advancement for voucher holders and low-income renters. Plan strategy 8 was to create plan strategy for researching and acquiring funding sources. That work is currently being taken on by the Affordable Housing Advisory Committee. The timeline needs to be adjusted in that work as it moved from a subcommittee to the full board, but that work plan is available on the City of Lawrence website, Affordable Housing Advisory Board page. Strategy 9 is developing a community engagement plan, and that plan was developed for ongoing community engagement to support the affordable housing efforts through this plan. The structures are now in place to support the collaboration and the public impact moving forward, and you'll get to hear from that group also tonight.
Could I ask a question on the previous slide? I haven't heard of Cohen Esri or the Annex Group. Can somebody tell me about those?
I am actually not familiar with those groups either. I have not worked with.
The Annex Group I'm not familiar with, but I know Cohen Esri is one of the it's a private developer that has gotten Affordable Housing Advisory Board funds. And I think the Annex Group is the same.
Thank you.
Erica, I've got a question for you before you move on from the strategies that are completed. You mentioned for strategy 3 that it's considered completed because you all made recommendations, but you also mentioned that at least some of those, or maybe all of those, I don't remember exactly what you said, recommendations were not necessarily adopted. I'm not asking for an exhaustive list, but can you give us an example, something tangible about something that this group was hopeful for to be incorporated and ultimately wasn't?
Yeah, so we worked on that it feels like several years ago, probably about 2 years ago. I don't want to tell you the wrong information. I can't remember exactly what some of those off the top of our heads were, but it was, I think some of it was fee waivers along when it comes to permits and some of those other things that are required for developers, just bringing down some of those cost barriers to especially affordable housing developers. So that's kind of a broad generalization without being able to go into specifics.
Yep. Could you go back one more slide as well? Okay, maybe forward one. Okay, maybe forward one more. Okay, so my question is around, I believe you have a strategy that is completed around.
Did you want this one? She hadn't quite gotten to this one yet. We were still on this one.
All right, so go ahead and I'll see.
Sorry.
Yeah, go ahead. I'll go ahead. You'll go ahead and my question will come up.
Okay.
Thank you.
Great. Thank you. So the next slide is some of the, Yep. The next slide is some of our ongoing strategies that we're currently in the process of working through. So strategy 1 is providing grant subsidies for new units. And as you can see linked right there, there is a dashboard that you can go to that shows the number of units that have been successfully developed and rehabilitated because of the grant subsidies. The strategy remains ongoing and just aligning with different funding cycles and project readiness. Some examples of completed projects are Delmar Place, Harper 7, the New Hampshire Street Lofts, and Union at the Loop. In strategy, that's not what my notes say. All right. So in plan strategy 4 was to establish a tenant right to representation. And let me see if I have that in my notes. And strategy 6 was establish the City of Lawrence vacant structure. And that has actually been revised to establish a City of Lawrence vacant structure ordinance. That ordinance is being worked through right now through the city with an anticipated approval in early of 2026. Planned strategy 7 is the establishment of the City of Lawrence Affordable Housing Initiative policy. That program encourages new affordable housing development, and that policy is currently in development with an approval anticipated in early 2026. In progress and advancing are developing a 10-year community housing plan. When we started working, putting together the APFE, there was a recognition from everyone that while this is a great plan in the short term, we needed something more of a long term, and that's where this plan strategy came from. There is work underway toward that housing framework, and once we get the affordable housing study back and that data, there will be some realignment to that strategy in order to align that data. On strategy 12 was to develop a program that increases racial equity in affordable housing access and home and land ownership for BIPOC communities experiencing housing disparities. There's a work group working on this, and right now we are identifying targeted programs addressing racial disparities in housing access and ownership and mapping data as it pertains to housing access in our community. Plan strategy 13 was identify and recruit affordable housing developers to Lawrence. Early exploration of expanding community capacity for affordable housing development through new partners and developers is ongoing currently. Some of our upcoming strategies are creating permanent and sustainable diversified funding sources for the Affordable Housing Trust Fund. Early discussions around permanent and diversified funding sources have started with AHAB, as you heard me talk in the beginning, and it remains in the beginning stages. And then the challenges that we are experiencing, one of our biggest challenge right now is that when we started putting this plan together, we had just come out of COVID. And so some of our goals were pretty aspirational, but we knew that going in and putting those down. And it was based on outdated data. We didn't have a ton of data to back what we were thinking. We had a little bit, but we didn't have an updated housing study. And so the revisions to those goals are awaiting that updated affordable housing study from the community. Another just challenge that we face is just capacity. Jill mentioned before, we're all doing this work on top of our daily jobs that we're currently doing. So capacity in leadership and deciding how to move forward as a coalition and at a coalition level. And then while things have been implemented at this point, just continuing to make sure the work moves forward and the capacity that surrounds that. And then you're going to hear this multiple times tonight. We're all working off of the same funding sources currently. So there is a need and a push to identify new and innovative funding sources in order to make this work advance. So thank you.
I noticed one of the strategies was for all landlords to accept vouchers.
The income discrimination. Yes.
When that was passed, what was the mitigation strategy to ensure that if a landlord did have any sort of damage to the property, what was the back end to support that landlord in some sort of mitigation to the property? Was there something to, do you have a fund actually to support the landlord?
So I'm gonna ask that I can provide that information at another time. I was not part of that strategy or that work group that worked on that strategy. And I know there were a lot of those discussions that happened, but again, I don't want to give you the incorrect information, but I would be very happy to connect with that work group and provide that information for you.
Is there someone else at the table that knows that information?
I don't think so, but we can definitely provide some follow-up conversations on that. It would be, our colleagues with the city of Lawrence, the city attorney's office takes most of those complaints. Is that right? For the source of income? We'll follow up their perspective from the city, but also from the housing authority, I think would be helpful as well about how those are reported. Yeah. Did you want to?
I know we got to keep moving through
You're
the
good.
presentation. But Brandon McGuire, Assistant City Manager, City of Lawrence. I also did not work on the ordinance itself or the program administration, but my understanding of it is it's a source of income protection. So it protects applicants from discrimination from landlords discriminating, if they may be coming with a voucher or other sources of income, a gift or something like that, rather than just coming with their own cash to the table. So then damages that might happen with a unit would be addressed through the contract, the rental agreement that a tenant would have with their landlords. And I believe that's consistent with how HUD vouchers are administered too.
Yes. And the housing authority also manages a whole separate fund for damages and damages to units, that the county's one of the funders of those. And that's that's been very successful. So it meets landlords where they're at when they assume a risk of housing an individual that is, working with one of our partner agencies. It gives them the assurance that if the unit's going to be damaged, then we have funds to help with that and mitigate that risk.
Okay, all right. So maybe we should have some more conversations because I think if all landlords across Douglas County are required to take a voucher, because is that what I'm hearing?
They're not required to, but if the decision is made to deny housing to an individual solely because of the way that they're paying for it, if the individual can document that is why they think that's the case, they may have a reason to file, again, make a filing that they have been discriminated against in accordance with that ordinance. So it's not a guarantee, but it is a protection.
Okay, all right.
Is that both a city and a county ordinance?
It's just City of Lawrence.
Thank you.
Sure. Okay, we're going to go into, well, I want to thank Erica first. Thank you for pinch hitting. Galal Obaid with the Lawrence Douglas County Housing Authority and Leah Roslin with City of Lawrence they have been the co-conveners of affordable housing. Erica has been a leader in some of the work groups as well, but I want to thank her for pinch hitting today. There was a lot there on on affordable housing, and affordable housing is our foundation in many ways. You have to have affordable housing to have supportive housing. That's the foundation. So we're going to dive into supportive housing. This is a list of all of our partners that we have here. Everyone from tenants to homeowners to 9th Street Missionary Baptist Church, Mirror Inc., and everyone else that's on there. And I want to flag also, before I dive into these accomplishments, that the supportive housing piece of A Place for Everyone is an important intersection between the behavioral health component of the community health improvement plan. So Bob and I really tag team a lot on the supportive housing piece because there's so much overlap with the behavioral health components of the community health improvement plan and the work that we're doing with A Place for Everyone. So some of our accomplishments, 221 units have been committed, had funding committed to them from 2023 through 2026. That most recent addition is the plus 17 in 2026. That includes, all those numbers include everything that was funded through CARES Act projects, ARPA, and decisions that the commission has made to fund programs like the flexible housing pool, which is now 32 units of housing. So that's what that's a significant addition that we've made to the ecosystem, representing 60% of the total need that was identified in that Corporation for Supportive Needs assessment. I have a little typo here, sorry, where it says Supportive Housing Best Practices Group, but that is the next bullet that's supposed to be one of our accomplishments, that we have established a regular meeting Supportive Housing Best Practices Work Group that is 20 plus individuals from all those partner agencies meeting regularly. Next meeting's tomorrow, talking about what are the best practice components of getting folks housed and then making sure that we're providing the necessary wraparound supports that prevent them losing that housing again. So it's taking the tools and the training that were provided to Douglas County and our partners from the Corporation for Supportive Housing a couple years ago and putting them into action and refining as they go forward, and coming up with innovative solutions. Like if you ever want to take a deep dive into what that looks like, it's things that Sarah Kinder and Kristen Egan can talk to you about, convening care team meetings. When someone's been recently housed or they've been housed, but things are getting a little shaky, convening all the partner agencies together to say, what's happening? How do we get things settled? Who's going to do what? And just try to intervene and prevent somebody from losing their housing again. So that's some of the innovative strategies that we talk about in that best practices work group. Tomorrow, we're going to be talking about what is a Heartland RADAC peer recovery coach. It's a really important component of keeping the individuals housed and supporting them. So then we have a whole lot of collaborative efforts underway to develop service and funding models to provide expanded supportive housing, capital investments, and services for unhoused women and children. I talked about the disproportionalities for women. We don't have a family shelter. We don't have enough supportive housing services for women and children. We've got a lot of exciting things happening when you think about the work that Cardinal Housing Network is doing. And that network term is really coming to bear in the conversations we're having today. What does a collaborative partnership look like in terms of working with the other agencies that can support and are supporting women and children in the community? Challenges and next steps. This is one of the strategies that we had that we just, it's timing on getting development of a 5-year supportive housing capital improvement plan. It's challenges in terms of just pulling all the pieces together, but also thinking realistically about what are the sources of the one-time and ongoing operating funds that are needed for programs. So I give an example of the Cardinal Housing Network. That's an organization that has received one-time capital funding. And there's still a lot of questions in terms of how do we make sure that operating model is sustainable. That goes for every other project that Douglas County is a part of. We need to make sure that every project has a sustainable operating model, and we're thinking creatively about the funding sources for them. It's been difficult to forecast those funds given the limited dollars. And the uncertainty at a federal level is one of the key considerations of that. And then solutions for acquiring properties for future development. One of the examples that's on there is the Rockledge project that there's uncertainty around happening, and we'll have to figure out what will happen with a project like that. And how do we plan for the future, and how do we develop a 5-year vision when there's so much uncertainty? And then, I talked about just equity issues for women. We've had Artists Helping the Homeless open in Douglas County for almost 5 years now. That exclusively serves men exiting Douglas County Correctional Facility. We don't have a parallel program for women, and we want to continue to understand, is that a need? Before I go to systems, Bob, was there anything you want to add about supportive housing?
No, other than to say, one of the things we've done is we are trying to bring projects online. And as we try to bring projects online, we discover what makes that difficult. And I think in the supportive housing area, one of the things that we've learned is this is harder than you imagine that it's going to be at the beginning. And that's not news to us from the folks that have been doing this work for a long time. So, you know, Rockledge is an alternative to the Rockledge project. That was 20% of the plan for those units. We need to figure that out. The justice involved transitional housing project did not come to fruition in the way that we imagined and hoped and aspired to. And so it requires us to go back to the drawing board. The nice thing is that the drawing board and the table's established. And so the work will continue, but in some places we are returning back to the starting point. And that's okay, because when you see the amount of progress that's happened, we should all feel good about what we've done so far, in my opinion.
Thanks, Bob. All right, I'm going to hand this off to Sarah. And I should have said at the very beginning, take notes of like things that you want to take a deeper dive on. This is going to be an area, and there's some handouts that you have that Sarah's going to navigate around, but this is an area that you may want to take a deeper dive on. What is coordinated entry list, by name list, HMIS? It's a lot. So we're going to do our best. You've got the subject matter expert. Sarah's position is funded through a contract through Douglas County to the Kansas Statewide Homeless Coalition. Her position exclusively serves Douglas County. She is our full-time regional coordinator. She does a tremendous job, and she fills a very important need. So I'll hand it off to Sarah.
Thank you, Jill. And yes, as we go through this, if you guys do have questions, I'm more than happy to meet with you at another time and dive into this deeper. There's a lot of terms we use, and I'm going to try to simplify it as much as I can. To start with the update, so we have our partner agencies here. We work with a ton of people on the system side. Go ahead, Jill. Yeah, we can go. Our accomplishments were that we achieved quality data through Built for Zero. So quality data, we realized that in order to solve homelessness, we need to see the problem and understand what's going on. So quality data means that we know the data is coming from the right source, that it's accurately capturing who it needs to be, and that we understand the true inflow and outflow in and out of homelessness. To get here, it required us to change how we communicate with each other. It required us to cross-agency collaboration and to pull us out of our silos to actually be working together. It really changes the perspective from this is my client to this is our client. Quality data, now that we have it, it lets us know where we need to focus so that we can make targeted improvements. And we are the 88th community to achieve quality data through with Community Solutions Help. It's a pretty intensive process. And we also implemented an HMIS training schedule for partner agencies, because all of this quality data is entered into HMIS, which is our homeless management information system. And in order to have quality data, we have to have everyone knowing where they need to be clicking in the system. So doing all those trainings. Another big accomplishment is that we got the A Place for Everyone dashboard live, and it is updated monthly. We've actually updated it since this screenshot here, and we now have unsheltered and elderly categories that you can dive down into. That's another great thing about getting all this data, is we can see who else what categories we need to be looking at. And yeah, it shows, yeah. So for challenges and next steps, maintaining quality data and provider participation in HMIS, this is an ongoing process. It requires a lot of maintenance to keep this going, and making sure as any new data errors or issues arise, they're addressed quickly and collaboratively as a community. It's just really all about being more responsive. And now that we can trust our data, we can start to utilize it to make targeted improvements to the system, like I was saying. So we'll dive into the handouts that you have now, just to kind of go through. There's a couple of different terms we throw out that can get confusing, different data that we're collecting. So for the first one, we're going to look at the systems understanding the homelessness data. So this, we'll start with talking about the point in time count that just happened at the end of January. The point in time count is a snapshot. It's a single night of the year where we go and count everyone, both sheltered and unsheltered. It's good for tracking trends over time, understanding the general makeup of the unhoused population, and it is federally required. It is the only nationwide standardized data, and this data goes directly to Congress, feeds into a report that goes to Congress so they know where resources are needed. So it is very important, but it is just a snapshot. It's not a full count of everyone who experiences homelessness. It is everyone at the end of January. It's we kind of think of it like a stress test on the system. When the most people will be accessing shelter, when it's the coldest at the end of the month, are people still unsheltered? Do we have the capacity to shelter everyone that needs it? It's important to note that it often undercounts people who are highly mobile or avoid contact, and it should not be directly compared to the by name list or CES because it is measuring something different. It's just one night. Next, looking at coordinated entry list. This is who is actively on our coordinated entry list. Coordinated entry is how people access, are prioritized and referred to, assessed, prioritized and referred to housing, HUD-funded housing programs. So CES is required by HUD, and it is a program within the Homeless Management Information System. So the CES list is people who have been given an assessment and agreed that they want to potentially access these housing programs through HUD. So it's good for prioritization, managing our active referrals to housing, understanding who is currently engaged with coordinated entry.
And
So-
Sarah, we require folks for flexible housing pool for our locally funded vouchers. We also require that they be entered into this coordinated entry system.
Yes, thank you for pointing that out, Jill. So the CES list does not capture everyone. It is what we used to use year round before we had the by name list because it was the list that we had. So getting into the by name list, this is the Built for Zero stuff. It's who is experiencing homelessness over time. So we think of the point in time count as a snapshot. The by name list is more like a video of actually seeing live how things are changing each month. So it's a real-time system-wide view. It's generated from multiple program enrollments in HMIS. Any programs in Douglas County are in there, and it uses a 90-day window. So when someone is enrolled in a program, then once they're exited, so for example, for the coordinated entry program, they'll be enrolled in the program. If we don't have contact again, they are exited after 90 days, and then they have 90 days of inactivity. So it's kind of a bigger window that a much bigger window that we're measuring with the by name list.
And Sarah, that what's on the dashboard, that big 583 on this screen, that is that number. That's that 90-day, that's the 90-day snapshot. In those 90 days, 583 people were enrolled, were in that by name list. Is that accurate?
Yes.
Okay. Just to navigate back to, if you want to look at this data in real time, that tracks back to that number.
Yes, in this, we can actually see how many people we are losing track of, how many people are actually getting housed successfully, and how many people are entering the system.
And these are unduplicated individuals, right?
Correct. This pulls the most recent enrollment in HMIS, so but only one per person, yeah. Okay.
If you want to quickly go through those others, the other handouts, we'll get going. I'm sorry.
I got a
Yes.
question on this. A week or two ago, there was a article in the newspaper about the highway patrol removing people from KDOT and turnpike lands up north. Was anybody from this group involved in that? And my question would be, were any of those people on any of these lists?
Christy Shutter with the Homeless Response Team, Homeless Solutions Division for the City of Lawrence. Our outreach team actually reached out to those people on at least a weekly basis leading up to that camp closure, trying to get them access to resources. Yes, they are all listed on this by name list. There was, Kelby and I were actually called out that day to get some people to the shelter. The Highway Patrol had reached out to us. We went out and provided transportation to individuals to the Lawrence Community Shelter that day. But yes, we reach out. A lot of those people don't want engagement unless it's really cold. And we were out there with the UTV before the storm, getting people to the winter emergency overflow shelter the days leading up to and the days of the last cold snap. So
If I'm
yes, like a UTV, like a
utility vehicle.
Yes, that goes out in the woods. Yes, there you go.
They're an adventure team.
I might,
All bundled up.
if I may, Commissioner Dorsey, I think to pull on the thread of your question a little bit more, I think the by name list should be representative of everybody that's ever been contacted by somebody on homeless resource team, which would be representative of folks who may not be sheltered, and anybody who might be staying in shelter or elsewhere. I think, and feel free to correct me if I'm wrong, Sarah, if I'm representing this wrong, but the folks who may not be named on the by name list are sort of the folks that are experiencing invisible homelessness, the folks that are doubled up in people's homes, and that may not be actively engaged with any community services, and sort of there's no visibility to it because it's not street homelessness or not sheltered homelessness. So I imagine that the number in fact is larger always, but it's hard to know by how much because of that invisibility factor.
Yeah, I appreciate you bringing that up. It only captures people who meet homelessness by HUD's definition, which is people on the streets or in shelter. It's not capturing people doubled up. So going through this next handout quickly, the systems by name list. This shows you how we're sorting the data, with the inflow being newly identified people, the actively homeless, that you can actually see the list of all the agencies that are entering this data into our system for Douglas County, what enrollments are being pulled for this, and the outflow, which is housing placements, people connected with permanent housing, moved in activity, which is people who we lost contact with or no longer meets population criteria. So they're no longer considered part of the target population, such as no longer experiencing homelessness. And jumping to this last handout really quickly about the coordinated entry system. We kind of talked about some of this when I was talking about coordinated entry, but this outlines that so people are identified as unhoused either by outreach, shelter, or other providers who are access points. Diversion or rapid resolution is attempted with them. If they're unable to be diverted, then they're entered into coordinated entry. And coordinated entry is not a solution to all housing problems. We can't house everyone through coordinated entry. So from there, some people do receive referrals to housing programs. Some people get on the housing authority list and are able to get a voucher. Some people self-resolve. There's a variety of reasons that people may leave the list.
Thanks, Sarah. And Sarah convenes those meetings every week. And we talked about getting assessed to be on that list. If a community partner can't do that assessment, Sarah will go out and perform that assessment as part of her role on behalf of Douglas County's service agreement.
Yeah, I didn't talk about, we have weekly meetings where we go through the CES list and where a lot of this collaboration is happening.
On the dashboard, it is 90 days, and that's a filter that's set as far as I can tell. Is there a rationale on why that filter is set for 90 days?
It's so that if we lose track of people, that they have an opportunity to be re-identified, reconnected with.
Can you tell me more about that? I don't understand why that would be the reason for that. Maybe I just don't.
I think Kristen's going to offer something.
Okay.
Hi, Kristen Egan, Douglas County. We don't make that determination. Community Solutions Built for Zero makes that 90-day consideration. That is how their framework is set up. It's not a choice we made. The goal is to allow people to maybe fall off from their service provider, but come back because they haven't actually solved their homelessness. But it can be hard to stay in touch with your service provider. So we can't assume they've self-resolved for 90 days. That's what I would guess Community Solutions rationale was. Guess.
But that's also something we can do a deeper dive on. Community Solutions is a framework that we, the state of Kansas, lots of other communities have used that built for zero mentality. And we even talk about that 90 days, what the inflow, the outflow, the active. Why is that framework relevant? I think we can probably bring some colleagues from Community Solutions maybe to participate virtually and answer some of those questions, why that framework matters. Okay. I'm going to let Christy kick us off, I think, on emergency services. Okay.
Again, Christy Shutter with the City of Lawrence Homeless Solutions Division. So obviously, one of our major partners is the Lawrence Community Shelter. And we also partner with the First United Methodist Church for our winter emergency shelter overflow, which I'll talk a little bit more about both of those. Huge accomplishment that we have had, obviously turning 40 beds into 223 with the Lawrence Community Shelter. So what that looks like is there's 125 beds now inside the main building. Those are either night-by-night beds or the 90-day program participants. We also have the village off of Michigan where the little pallet homes are. There are 50 there, which is a 90-day program. And then there are 10 medical respite units behind LCS that is referred to as Monarch. And then there are the new Pallet 24 that just opened in August this year, or 2025, which is the low barrier shelter that is also accommodates pets, and that's also a night by night. So that can accommodate 48 individuals. So that's where that number comes from. We also have the winter emergency shelter overflow, which I mentioned. We can activate that within an hour as LCS gets to capacity. They will contact us, and within an hour we can go in. We have staff and volunteers ready to, open those doors at any point when the weather drops below 32 degrees. And then it will remain. And then at that time, LCS also will open doors to non-residents, and they can remain there. If the temperatures are going to remain below 32, they can remain there during the day and not sent back out onto the streets during that time. As a result of that, we had through 2024 and 2025, 0 weather-related deaths, which is the first time in over 2 decades has Douglas County seen those results. So we continue to improve in areas to keep that going. I'm going to invite Kelby Sanders up, and then Jonathan Smith is going to talk about our outreach portion.
Yeah, go for it.
All right. My name is Kelby Sanders. I am the homeless response team outreach lead. Switch to the next slide, right? Handsome fellow back there. There you go. City of Lawrence has partnered with Mirror Inc., Jack's Project, and Lawrence Douglas County Public Health. We have built a multidisciplinary housing-focused street outreach team. Our team consists of peers. We're all somewhat have lived experience in some way, shape, or form that has impacted us either in homelessness, mental health, substance use. something along those lines. So we've integrated a peer support team, medical behavioral health, substance use treatment, and harm reduction. We provide Narcan and fentanyl test strips when we are out with our community. We have helped coordinate encampment closures with follow-up services. None of our individuals that have been removed from any encampments have had no option. There has always been some sort of option of shelter or something there. We've also offered individuals that are non-residents the ability to return to their place of origin, provided by bus tickets and us accompanying them along the way. I have personally driven people back home to families. Integrated peer-led outreach model to build trust and sustained engagement. All members of the team, like I said earlier, we have lived experience. This is a model that has been recognized both locally, nationally, statewide. And we have reduced unsheltered homelessness by 63% over the last year. You're welcome. Thank you, guys.
Afternoon, Commissioners. Jonathan Smith, Lawrence Douglas County Public Health. I can talk a little bit about our involvement, and I'll be brief. So back in 2023, I believe it was the fall of 2023, Jill was convening a meeting with a whole bunch of community partners and said, hey, we really need to do something to bring medical care to people experiencing homelessness. And at the time, we didn't have any nurse practitioners at the health department, but we looked outside and said, hey, we got this big mobile unit. We should probably do something with that. So that's when I call it the why not idea became a reality, and what's called Wellness Wednesday, which is still going on to this day. So Wellness Wednesday, if I was on a 2-floor elevator with you, I would say it is a gathering of community resources. So on the last Wednesday of every month, we take our mobile unit out to either the Lawrence Community Shelter or the Pallet Village. We let LCS determine where to go. And I would say the most beautiful thing about this whole process is it is not, I don't call this a Lawrence Douglas County Public Health thing. At a Wellness Wednesday, you're going to see Lawrence Douglas County Public Health there every time, but you're also likely to see community health worker from Heartland Community Health Center. There was a time when the library, Dottie, was there. There was a time when the Humane Society was there. So it really has become, over these last few years, a gathering of community resources. So we had our first one in, I believe it was February of 2024. And so we then took it to another level with, we started to get more nurse practitioners at the health department. And one of the nurse practitioners that we have, we work with the city and county. That's a jointly funded position. We call it our outreach APRN. And so now we still do the Wellness Wednesday on Wednesdays, but having the outreach APRN, 2/3 of their time is spent literally out in the field, like riding around with the homeless response team. The other third of their time is spent with Lawrence Douglas County Fire and Med Mobile Integrated Health Team. So it really enhances the scope of what, that team is full of paramedics, but when you add a nurse practitioner to that, that actually helps us. And there's been plenty of cases where this has happened, where the ambulance has showed up somewhere and we said, it's okay, you can go do something else that's more emergent. And we took care of it right then and there. So that's to speak on some of the outreach that we've been doing. Like I said, it's been a gathering of community resources. Been doing Wellness Wednesday for a while. If you remember, I think it was my first supplemental request that I ever did for you all, but you also notice that we haven't made another one because we've baked it into our operations at this point, and it's not something that we intend on ever stopping. It's working, and we've even seen folks get housed from this, because health is a large part of that as well. And I will say, at first, it was a little bit of a challenge because it was difficult for people to trust us, but that's why we wanted to be consistent and say, this is the time we're going to be here. This is the day of the month we're going to be here. And it's been the same ever since. So now we went from having to recruit people to show up, or, to get people to see visits. Now we don't have to do any recruiting. They tell their friends about it. And that's been really good to see. But the most beautiful thing is to see all the different community partners show up, some of them unannounced sometimes. So,
Can I do that?
Yeah.
Thanks, Jonathan.
And so that's the last Wednesday of the month. And the following Wednesday is also Wellness Wednesday through the Peer Fellows and Jack's Project. And that's at the Human Resources Building. That's grown into what is a combination of doing some craft or some type of art project together. eating lunch together, and then there's some programming component. And that's the type of thing that Christy in a previous life and role helped to build with Alive Inc. and the CRO. And I look at that picture with Kelby doing what he did. And I remember the first time before Jonathan was even with us, when a community member said, why don't we try a free medical clinic at the health department? And a lot of people said, what, are you crazy? And then we did that, and that's what the public health department built on. So this is, when you see something like this manifesting itself in the way that it does, it's that spirit of collaboration and then staying dedicated to what does integration really look like. And so I think, and then the following Wednesday is Recovery Wednesday, and we have 2 of our peer fellows who are facilitating a recovery support group as well. So we identified a gap as Wednesdays. There were some gaps happening on COVID, and now Wednesdays are full with a lot of opportunities.
We still have 6 other days in the week. We haven't came up with names for them yet.
Christy, you want to talk us through this last slide?
Yeah, so obviously we have some challenges just like everyone else. The first one being, like everyone else has mentioned, in funding, right? As the annual funding reductions that we have encountered has resulted in a loss of our VA housing specialist, our Heartland Rate Act recovery coach, and our justice involved peer support from Artists Helping Homeless. So that's what we have encountered this year. And then obviously not having a women and family shelter like Jill talked about has caused problems, but we have been able to have temporary partnerships with Family Promise and then some local hotels during that winter emergency shelter option, so that that group of people is not excluded from having those options. Our daytime resource gap, when people go to the shelter for night by night, they are asked to exit by 7 a.m. And that results in no centralized day center. I know HRC is working on getting permits and expanding hours, but right now we get a flood of phone calls because of people at the library, storefronts, and downtown corridors, right? And so that's an obvious issue, and people's like, oh, there's so many homeless. Well, they're not at night, but during the day, they're limited on where people can go. We also have had an influx in non-residents coming into town, which has resulted in us having to implement a residential policy. But like we said, we are working on getting people back to their, returning to their, we do confirm support wherever they're returning to, and then we can arrange for transportation to go back to where they were from.
I got a question. I don't know who to ask this, but does anybody have a wild guess as to how many homeless are on disability?
So as far as that are on disability or that have a diagnosed
getting
disability?
payments from Social Security.
In the PIT count? Chris, yeah, go ahead.
Yeah, we will have that data available from the PIT count. We ask if people have disability, and that may be something I can pull from HMIS as well. I can look at getting that.
Well, I had a son who was severely mentally ill. His disability payment was $947 a month. How can you survive on $947 a month?
I'm going to let Stacy go through our last part of our plan.
Yeah, Stacy Schroeder with Lawrence Habitat and the co-convener for this group. Well, as we've just set through, 45 minutes of this is where community engagement comes in. We've had some great accomplishments in engaging the community, but this is a big, heavy conversation to just have with every community member. And so we worked really hard this year to create a toolkit that takes everything that you just heard and makes it digestible in about 20 minutes. with questions. And so we're working on getting that out into the community so that people know that this plan exists and that we need the support from the community to make it possible. This past year, we were able to launch our website. It does have that dashboard, but we are directing people to the website for more information. And so you can see viewership for that is growing. We had the opportunity to do a lot of community presentations, Rotary, Kiwanis, Sertoma. So connecting all of this information that you all heard today into a group format so that they can hear information and take it back into their neighborhoods. We participated in a lot of community tabling, just spreading the word, getting the information out. It tends to be that people are interested in one piece of the plan more than another. It might be that affordable housing is their thing, or they might really be into hearing the emergency services information. So taking those little pieces while we're tabling and connecting them with that piece is something that we really focused on this year. We've had a lot of one-on-one conversations, just engaging the community. People don't know what they don't know until we tell them what's going on. And so just having the time to connect the community with the plan, they're so excited about what we're doing. They just didn't know that it was happening. And then we had the opportunity to partner with KLC to host a better debate. This was an event held in this past December where we welcomed the community to come in. It was a debate format, but it was a really great conversation and gave us some really great points to tackle in 2026. Like I just said, if they don't know, they don't know. And so that's something that we're just trying to continue to spread the news about what this plan looks like. Our community engagement group is kind of twofold. We're working on just communication, so making sure that all of our community partners and all of this great work that's happening, we're getting that out into the community. They're getting updates, they're getting press releases, so that's part of our group is working on that. The other part is volunteer engagement. So when people hear this information and you hear things that are happening, you say, I want to get involved in that work. We want to connect them with an opportunity to get in a part of this work group, to help us table, to spread the news, because this truly is our community plan and we need our community members to be a part of it to make it successful. So.
That's the last of it. And I'll just share with commissioners that we're going to do this same presentation next Tuesday, City Commission. So your peers will have a chance to see this information and yeah, we'll open it up for questions.
And I just want to say thank you. You all have done a lot of work and over the last several years, I think since 2021 is what I saw on the slide. And I would just like to challenge everyone as you move this work forward, as we think about supportive housing. I did not see any particular timeline on there as around like months for individuals in supportive housing. But when we think about supportive housing and success of supportive housing, have you identified for how long an individual is in supportive housing? So like, for example, supportive housing placement, when I think of it, success only, it can potentially be successful within 24 months. If it shows a sustained reduction in voucher reliance, emergency service utilization, and law enforcement calls alongside measurable increases in earned income or documented clinical stabilization. So when I think of Union on the Loop, there's a lot of law enforcement calls at Union on the Loop. And so I would like to see less calls at Union on the Loop. And so when I think about clinic stabilization and the individuals that are there, if we could see less calls at Union on the Loop, more stabilization at a unit like that. And so when we think about this moving forward, how are we really supporting the individuals that we are putting in different places? How are we really supporting the population that we're serving? Are they constantly waffling back and forth from different locations? Are they consistently being evicted? Ideally not, right? Because that is constant destabilization for them. That is a constant waffle of back and forth with trauma. And so how are we really supporting them and ensuring that they're not constantly experiencing trauma? And as we look at knowing that we do need sustained funding, and ideally the siphon isn't consistently on. And so how are we truly sustaining this work and the individuals that we truly do want to support. We know that here at Douglas County for the region, for the COC, we are funding the only FTE across the entire state of Kansas. And so we know other counties are not funding this work. They're not asking other counties to fund this work. And so if we are the only county funding this work, and we know that they are dropping them at our doorstep here in this county, and we are funding all these resources. Sarah, we are so appreciative of you and this work and that you are here doing this work. But if we are bearing this burden and we are funding this work, then we need others to come to the table and to do the work in their counties as well. And we need the COC at the top of the spine to help us do this work. And we need the state to help us do this work because we are not the only ones who are bearing this burden.
Commissioner, I'm happy to come
Collective
back.
impact, right?
Right.
Collective impact is more than Douglas County.
Yeah, and I think your comments about supportive housing, that's a great opportunity maybe for that supportive housing best practices work. Maybe come back at a later time, maybe to take a deeper dive into what does that work look like? What does that model look like on preventing folks from losing their housing?
Jill, can I respond real quick? Okay, I would just want to give you one example. We have a work group called Familiar Faces, and we were discussing an individual who had gotten housed December 1st. Prior to December, the 5 months leading up to his chart, I think it was 44 times did he have calls to either ambulance, ER, leading up to him being housed. Since he's been housed December 1st, he had a traumatic event. One in 2 months, December and January, he had 1 visit to the ER versus 44 the 5 months leading up to him being housed. And that's because of the wraparound services that individual is getting with that supportive housing voucher and the support that the agency's coming in and giving him that support. He's med compliant. He's reduced his drinking, like all of the things.
And that's fantastic. So if we could follow that individual, right, for 24 months and see if that is a sustained, right, improvement for him, I'm going to call him Jimmy, whatever his name is, right? If we could see that sustained improvement for him and follow him, ideally, then we want to see that for 12 Jimmys, right? And then for 12 Janes, so that we can begin to see that sustained improvement overall. And then we're going to begin to see that return on health, a return on investment overall, and then the taxpayers that are actually paying for this across the board, they're going to begin to see a place for everyone has a place in our plan across the board for the city of Lawrence and for Douglas County.
So, and I think another piece of this is we talked about the by name list as it integrates with MyRC. Those are 2 tools that allow us to follow people when they fall in and out of the system and then collaborate. There's the data piece, there's the machine part, but then there's the people part to say, how do we do what the machine can't do, which is to give us the variety of interventions and supports that this person needs to stay housed. What's nice about what was developed by the folks in Johnson County and our IT folks is because we now have we have a familiar faces list as well, we can cross-reference those 2 lists. And we can watch this individual that Christy talked about fall down that list from being number 1 and 2 to last week, I think they were off. They were off the list. Yeah. So
There's a visual in the corporation or the KU Center for Public Partnerships and Research needs assessment that helps illustrate how we got to the point where we have, if you look at the dashboard, our number of chronic homeless, it's going down because of flex pool. But how that number got to 140, 150 and stayed that way for a long time was because people would get housed, lose housing, get housed, lose housing, get housed. So the conversations, and we even had one this morning, is what happens at move-in? What happens week 1? What happens at 1 month, 2 months, 3 months? How do we keep folks housed? And so again, I'll say, like, there are work groups that are talking through this, and if there isn't funding to support those care teams that make sure that that work happens, which is that's a weakness. We can't serve everybody with the funding we have. The HRT and Jack's project, they follow somebody for a year just because after they've gotten them housed. Their ability to sustain that, I mean, they just do it because just because they do. The flexible housing pool stays with folks as long as they need to be there. But the best practices is, can we challenge all of our community partners that once you get someone housed, can you try to stay in touch with them to prevent that cycle?
I did want to add one thing. I know we're running short on time, but I don't know if people noticed when I made the comment on, I made one supplemental request and haven't made another one. But you talked about funding, Commissioner Anderson. For the outreach that we're doing in the medical side of things, we've gotten really creative. So why I'm so confident that we're able to keep doing Wellness Wednesdays without supplemental requests is because A, we have a really good clinic that outperforms budgeted expectations. B, we have other resources like 317 vaccines that we get from the state for uninsured individuals. That's where we use most of them, is at Wellness Wednesday. So the reason I said that with my chest out is because it was like a small investment to do that supplemental that has now been baked into our operations. And so when you mentioned funding, I felt it wasn't related to, well, actually it is related to housing because you need health and housing anyway. So, but wanted to point that out and just brag on our clinic and talk about how that is now baked in our operations.
Commissioners, any other questions for right now?
I know we're past time, I'm sorry, but it is rare in our meetings that you feel the need to applaud. And I think there is a lot of things to applaud here. There was some specific data, there was examples to applaud, and that so much of that has been done in 3 years is outstanding. So I don't want to close our session without recognizing that there are some incredible achievements. To be at 60% of the supportive housing is an incredible achievement. You know, to have no deaths due to those winter months is amazing. To not recognize the work that the homeless outreach team is doing is really unfair. So we appreciate all the information. I wish we had another 45 minutes to say thank you. But I do have one question, and maybe it doesn't need to be answered here. It might be worth a deeper dive as we think about continually looking at the plan. Is there was a lot of engagement on the early side of the plan, and yet I'm noticing a few new partners there that weren't there. And as people have come to us as we've done, whether it's code changes or whether it's pieces of the plan like tenant right to counsel, I'm thinking about groups that maybe we didn't engage. And I'm wondering, and again, we probably don't have time for it, but how do we need to engage other groups? What have you identified in your work on your root groups thinking, this one we missed somehow to get them engaged? So I don't know that it needs an answer. I just encourage it.
Thanks, Commissioner Kelly. I'll piggyback off that and say I had a similar line of thinking, sort of. It was recognized many times that this is an iterative process. It's a living document. It's something that requires sort of constant assessment and realignment because of how things are actually going and what the reality on the ground is versus what our initial aspirations were. So yeah, I think it would be helpful to hear from the core work groups if there are partners that have sort of, or different groups or entities that we think need to be intentionally invited into the conversation. And one thought I had was thinking about the reframe of that lived experience section, and that to think about that in sort of a broad way, also in terms of inviting folks to share different types of stories about how they are trying to be a part of this change. And so it's sort of the tie to the community engagement piece. You know, there's we talked about lots of creative systemic solutions and collaborative things that are going on and making progress. And we also know that there's lots of individuals in this community who are making choices and doing creative things like providing housing to somebody that they go to church with that needs, needs some transitional housing, or being able to provide just different types of support. Somebody deciding that they can rent their property to the flex housing pool when that was something they maybe hadn't considered before. So those are very sort of minute things, but I think there's some power in the idea of thinking broadly about how do these housing issues and the belief in our community that everybody should have a right to healthy and safe housing and be able to sustain that. What are all the different ways that people are thinking about that and being a part of resolving it? So I think that that might be an effective way to think about community engagement and how do we sort of tell some of those stories, because I know they're out there. I know privately that some people share this with me, and I encourage them to tell all their friends and tell their congregation and tell their civic, service groups about how it is that they're figuring out what their role is and how they can be a part of the solution. And it's not just governments and institutions and the community partners doing the work, that it's neighbors taking care of neighbors too. And then I just want to put a point on the gratitude, and that I have deep gratitude for the work that has been done already and the progress. As a social service provider, the difference is palpable, and I have to remind myself of that some days, because the struggles persist and the economic pressures and the systemic issues that we can't resolve on a local level, but that we have to figure out how to navigate with people, persist. And that can feel really daunting sometimes, but the sort of collaboration and like commitment to that, even though it takes more time and it takes more energy and it takes more resources, the outcomes are visible and they're obvious. And it is something that I hope everybody feels sincerely proud of, and that you refocus on that whenever you're feeling the dread of how we cannot possibly provide housing for everybody on the that comes into coordinated entry, let alone everybody that's on the by name list, and that we just keep going and we keep chipping away at it, and we keep thinking of other creative solutions and ways to resolve where we can, and keep going until we find other pathways where we haven't seen them yet. So thank you all for your commitment to that. Okay, with that, if there are no other, do you have any other questions, commissioners? Okay, we'll go ahead and conclude our work session. Thank you all again. We will be adjourned or recessed until our 5:30 business meeting.